Doctors of Reddit, what was the worst thing you've seen for a patient that another doctor overlooked? Rattlesnake bite. On a 2-year-old patient and dad out in the fields near a small town that is several hours away from the nearest big city, where I work. Dad takes the child to the ER in the small town with an obvious snake bite. Doctor there says it's okay, she probably didn't get envenomated. Doesn't give the patient antivenin, which they had at that hospital, and instead of electing to send the child to us by helicopter, he sent her by ambulance. Several hours later patient shows up to our hospital coding, and ended up dying. Probably didn't get envenomated. What the fuck kind of stupid ass idea is that? If a tiny child gets bitten by a rattlesnake, you assume they've been envenomated and you treat them as though that had been. That means antivenin, physiological support, etc. Completely absurd. It wouldn't be a difficult case for a lawyer to win. As a doctor, all your clinical decisions have to make sense. If you examined a patient and determine this bite doesn't look serious, it doesn't need antivenom, then the obvious decision would be that you'd be comfortable sending the kid home. This doctor didn't do that, and decided the kid's condition was serious enough to be sent to a large tertiary care facility but didn't attempt to stabilize the patient before doing so. A lawyer could sue you without all of these steps simply because you were wrong and it resulted in irreparable harm to the patient. However, this doc's disjointed decision-making makes it an easier case. I'm the patient, but it's an important story to tell. From the age of about 17 I start getting regular abdominal pain every day and terrible gut problems. I can't seem to eat much anymore. I get fluctuating diarrhea and constipation. Menstruation gets more and more painful. I start losing enormous amounts of blood despite being incredibly small, less than 5 feet. Now you would think any doctor worth her salt could figure out it's a gynecological problem. But my doctor, a woman by the way, at the time insists it's anxiety and says she wouldn't bother testing for or treating a gynecological problem unless I was older and having trouble conceiving. Over the next few years my gut and uterus symptoms slowly deteriorate. I get bounced around the system to dozens of different specialists. I get told it's just stress, anxiety. Are you pregnant? Are you sure or you're not pregnant? Every woman has painful periods, it's just constipation, take this over-the-counter product, etc. etc. Meanwhile my gut function slowly grinds to a halt. A functional gut test took 6 hours to pass an egg sandwich when it should have taken 90 minutes. I weighed only 40 kilograms. It gets so bad I even start losing bowel control. No treatment seems to work. I was 24 and unable to work because I was literally uncontrollably ***ing my pants. Doctors suggest I should maybe seek therapy and suggest I could be exaggerating. Anyway, one day I see a new GP for some regular sexual health tests but get an abnormal pap smear. Within 2 weeks I go in for an exploratory laparoscopy to rule out cervical cancer only to discover I am absolutely riddled with endometriosis. On my bowel. On my cervix. On my perineum. On some ligaments. Ovarian cyst the size of a tennis ball. It was even in my gallbladder. With excisions and treatment I had my gut function back within 3 months. I will never be able to have children. If that woman when I was 17 had just done her goddamn job I wouldn't have lost 7 years of my life, my gallbladder, my fertility, and my mental health. During my residency we had this lady in her 60s who was getting progressively more forgetful, just overall declining and getting less and less able to take care of herself. She had been seeing her PCP who diagnosed her with dementia. And she saw a neurologist who agreed. She was not really able to provide an accurate history. After talking to her family and friends it became apparent that her symptoms were progressing unusually quickly. I remember seeing the point where her new hair growth met her bright red dye and also her grown-out nails with hot pink polish, thinking, wow, it really wasn't too long ago that she was not only taking care of herself but going to get her hair and nails done. The lady in front of me was so far from that. The neurologist I was training with recognized this, had her admitted and did every test including lumbar puncture. Workup eventually showed Creutzfeldt-Jakob disease, mad cow, which there is unfortunately no treatment for. She died a few months later, but at least we were able to prepare her family that she would only continue to decline so they could make arrangements. Really sad situation. He put the pacemaker lead in the subclavian artery, and across the aortic valve into the left ventricle. The proper approach is, subclavian vein to right ventricle. And then he didn't notice it for over a year. I saw the patient, a 25-year-old woman who didn't need the pacemaker in the first place, when she was in congestive heart failure because the pacemaker lead had destroyed the valve. A surgeon and I had to do surgery to remove the pacemaker and lead. Then replace the aortic valve. Totally inexcusable. Well, 50% of doctors are below average, but everybody thinks theirs is in the top 10%. I'm telling this a second time on Reddit, but I hope it helps someone. I was 26 and found a lump in my breast. Planned Parenthood had taught me self-checks, and so I knew it felt different than a cyst. It felt exactly like the tumors I'd been taught to recognize. First doctor says you're too young for breast cancer. I didn't accept that and went to a second doctor where I got it hurts when I mash it right. No. It gets bigger with your period, right? No. Sure it does. Third doctor, you'll have an ugly scar if I biopsy it. Fourth doctor, I told him to call the police to get my naked topless self off his table because I wasn't leaving without scheduling a biopsy. It turned out I had stage 2 cancer, and after surgery, 9 months of chemo, 3 months of radiation, and being told I couldn't have kids, I survived. I now have 3 kids and I'm 62 years old. If you think the doctor is wrong, get a second, third, whatever opinion. Listen to your suspicions. Not a doctor, but for years I've had migraines. They were mainly behind my eyes, but I chalked it up to stress and hormones. So did the neurologist I went to see for them. She seemed annoyed that I kept saying the pain is behind my eyes, in my temples, and the pressure was insane. She gave me Imitrex and sent me on my way. I went to visit my eye doctor for a checkup, and she did the exam and asked if I get headaches. I told her yes, but it seems like I always had one. She told me my optic nerves were very inflamed and excess spinal fluid or a tumor can be the cause. She sent me to a neuro-ophthalmologist where I had a brain MRI, a spinal tap and new medication to help keep my spinal fluid in check. The neuro-ophthalmologist said I was about 6 months away from vision loss, that I was lucky I mentioned my headaches to my eye doctor. After the spinal tap, they took out about 100 ccs of fluid and measured the pressure at 42, when normal spinal pressure is 8 to 16. Big middle finger to the neuro who shoved drugs at me.